Welcome back, listeners, to What Really Matters, continuing our three-part interview with Doug Jones, the veteran from Eden Hospital. 24 years he's been there, member of United Healthcare Workers. Doug, I really do appreciate the time you've taken with us today.
It's very nice to be invited.
Well, what I wanted to sort of drill out, we've talked about the SCHIP program and some of the problems that I see coming out of that program. But I wanted to ask more a general broad question. And again, this is based upon the number of years you've been in the industry as well as what you've seen in 3 years in the legislature. Is comprehensive health care reform possible?
I believe it is. I believe that there's a groundswell of public understanding of the issue that perhaps wasn't available in 1993 when a previous federal effort to reform healthcare took place. At that time, it was already developing into a problem, obviously manifested by the effort to reform then. What's happened in the years since, it's become progressively worse. What's happening is that one of the efforts of our program of It's Our Healthcare in California was to get people attached to actual stories that are happening to them.
Exactly.
Not just the benign general statement, we want reform, but having somebody write their politician, their legislator, and saying, because of the current system, my mother has to split her pills. Mm-hmm. Because of the current situation, my hospital that's right around the corner from me won't see me because I don't have insurance, and I need to travel 20 miles to the county hospital where there's long lines to be seen. Getting them attached to stories like that and giving those to the politicians, having them understand how bad the problem is, yes, I feel like there is great chance in coming months and years for substantial reform. And I would assert that AB 8 is a substantial reform. While not perfect reform, it is a substantial reform.
It is a step in the right direction. And listeners, I agree with Doug. As a financial advisor, well, I do like my statistics. Everyone knows that. But certainly, when you can see the human face of this tragedy, I think that's what really drives it home. And it is a tragedy. It's sad that in America, the best country in the world, richest country in the world, and definitely the most powerful, we're not taking care of our own, yet the poorer countries are. There's something wrong there, and that needs to be addressed. Doug, I wanted to touch briefly with you on labor laws and how those affect the healthcare reform. We had been talking off-air just briefly about the nurse-patient ratio and how in California we have that law. But you were saying other states don't have these laws, mandating one nurse for so many intensive care unit patients, one nurse for so many general floor patients. Why is that? Why is California a little bit ahead of the game?
Right. What happened in the early, in recent years is that the California Nursing Association, along with many other supporters, were effective in Sacramento to pass this law, which creates a maximum amount of patients that a registered nurse should be required to take care of, so that they can provide reasonable care. That was an important win in comparison to other states where on a medical floor, in California, a medical floor patient will take care of 5 patients maximum. In an intensive care unit, they'll take care of 2 critical care patients maximum.
Makes sense.
In other states, that medical floor RN might take care of 8 or 10 patients. The critical care nurse might take care of 3 or 5 patients. That obviously they're able to spend less time with the patient, concentrating on their condition. And this also doesn't, while the law in California addresses registered nurses, it doesn't address the other caregivers on the floor. Mm-hmm. A brief story is something that happened at my hospital. When the nursing ratios went into effect in January of 2004, one of my nursing floors, which previous to the law would have employed 6 registered nurses and 3 aides, the new ratios that my management gave to me required us to give 7 registered nurses and 1 aide for 35 patients.
Wow.
So what that resulted in was fewer caregivers on the floor than existed before the ratios went into effect. I questioned management on that, and I said, this doesn't seem proper to me. It's clearly not the intent of the law to create fewer total caregivers, more licensed nurses, but fewer total caregivers. I was told it was absolutely necessary for me to do it the way that they wanted. Now, we're concerned about that from the standpoint of patient care. There's more nurses on the floor, but they receive less aide support. The aide does vitals, the aide lifts the patients, the aide changes the bedpan. If RNs don't get the support of other caregivers like aides, respiratory therapists, phlebotomists, and other caregivers, patient care is still at risk.
As I think I'm hearing, there might be more nurses under this proposal, more nurses on the floor, but fewer caregivers. And again, I think I'm seeing an impact on patient care.
Mm-hmm.
So one thing that I guess that really frustrates me, listeners, but at the same time I'm heartened. The CNA, California Nurses Association, has fought hard for some of these changes, for basic patient health care. And it's unfortunate that in other states they don't have as effective in a union. One thing, though, that I am seeing, and this concerns me, there are attempts to weaken the California Nurses Association, the union itself. And specifically, Doug, you were mentioning off-air the Kentucky River decision. Could you tell our listeners briefly about that and what the real implications of it are?
Right, this has implications not just for registered nurses under CNA or any other organization, but healthcare workers under other unionizations such as SEIU-UHW healthcare workers. Kentucky River was a decision that was made earlier this year by the National Labor Relations Board, which decided that registered nurses who provide even light forms of direction to other medical staff are considered supervisors. Thus, they can be denied union representation because they're a supervisor or manager rather than an employee.
But a supervisor hires and fires. Heck, I've been a manager for many years. There's quite a bit more than just light direction. Actually, it's heavy direction when I'm doing it, but...
That's certainly the feeling of healthcare workers throughout the United States. We felt like the Kentucky River decision was a reprehensible decision that was meant essentially in a large way to weaken unionization, not just in healthcare but in other industries as well.
Now this came from the National Labor Relations Board, the NLRB,
right?
Which, as I thought I understood it, was meant to be fair in all matters labor.
It was the original intent of the organization.
Uh-huh.
What's happened over the decades is that the administration, whichever presidential administration is in power, appoints the people who are judges and other personnel in these agencies, including the NLRB. So what's happening in the case of the NLRB currently, Bush has appointed corporate lawyers and other such people to the NLRB, and thus they're coming forward with judgments like this, which we're very concerned about patient care applications. It's one of the main fights in a pending strike that's likely to happen at my hospital, is that the nurses are wishing to make sure that the Kentucky River decision cannot be implemented at our hospital.
Listeners, what this is really all about is patient health care. Taking care of the patient. Preventative, when that's needed, and if we get sick, get us in and get us out, but only when we're ready to go. That's all it's about. Nobody is here to deny anyone a profit. Certainly I'm all for profit and making a living, but I am here to stand up for the patient and say, hey, when I'm sick, will you please take care of me? And when I'm not sick, tell me what I should be doing so I can avoid going to the hospital. I don't think anybody really wants to be there, at least from a patient's point of view. Doug, I commend you for 24 years of being there. That's a battle well worth fighting. And listeners, one final point of what the unions are trying to achieve. It is about patient health care. It's also about the rights of workers and making sure that they are able to provide what they're employed for. In this case, the best possible health care. You got to take care of both sides of the equation. It's the moral right thing to do. It's the fiscally conservative thing to do. Doug, final question for you. What really matters?
In my circumstance over the last few years, I spent the first 19 years of my work at the hospital not involved in unionization. I became persuaded that it was necessary to do that because the changes that were taking place in healthcare were ones that I was voicing concern about, but that didn't have the effective ability to move the circumstance. Being involved in my role of advocacy with SEIU-UHW healthcare workers, while at the same time being an employee of Eden Medical Center, one of the Sutter Health hospitals, allows me to have a voice in which I'm able to affect healthcare and decisions that are being made by my hospital corporation. So what really matters, I believe, is respecting the whole of society, particularly people that have care and expertise in certain areas. Shared decision making is helpful to create a more compassionate, more meaningful, and more effective society.